For the most part, screening colonoscopies fall into two different categories. One would be average risk screening versus high risk screening. And average risk screening entails patients that don't have a family history, don't have a personal history of polyps or colon cancer or colitis. And typically we recommend that they begin screening at age 50 or so, okay? And then for a higher risk group, those patients that have the things I just talked about, we recommend a screening after the age of 40. And then there are higher risk groups beyond that, probably out of the scope of discussion of kind of general everyday colonoscopy. There's a lot of misconceptions about colonoscopies. Probably the most important thing is that it's painful. We make it so it's not painful. We don't want people to not come back because for proper screening and surveillance and to reduce their risk of colon cancer to the lowest point possible, we need to have them back at regular intervals. And so that's a common misconception. Other common misconceptions that it's embarrassing or something that people aren't volunteering to do this. However, it is one of the only things we have available in medicine to eliminate the risk of cancer. And for colon cancer, it's completely preventable. So embarrassing, painful, that the prep is that hard. Most people hear from their friends and family that the prep is really difficult. We try and make it as easy as possible. It's not super easy, but it's not super hard either. During a colonoscopy, we look for anything that's abnormal, but in particular, when we set a patient up for screening, our main focus is to get a very thorough examination of every bit of detail of the colon lining, because polyps can range from being very large or very small, and if they're a certain type of polyp, then they carry a risk of developing into cancer. One of the good things about colonoscopy is that for the general public, it's both a screening test, a diagnostic test, and a therapeutic test. And for greater than 95% of the lesions we find polyps in particular, they can be removed at that time, and the patient doesn't have to undergo an additional test. And one of the advantages of colonoscopy over other screening tests is that it takes care of everything, as opposed to if you had a flexible sigmoidoscopy or hemocult testing, you would again then have to have the colonoscopy performed to remove the polyps that were suspected to be there. Typically what we do is we have patients fast, except for a liquid diet, the day before the test, and then we have them take a prep, which usually entails a mixed volume of about 64 ounces to drink for 2 to 3 hours the day before the prep, and then they fast after midnight the day before the colonoscopy procedure. Colon cancer is the second leading cause of cancer death in America. 1 in 20 patients, if they live to a full extent, will develop colon cancer in their lifetime. So the risk is about 5%. It's completely preventable. We can take that risk down to almost zero if they maintain recommended screening and surveillance intervals. Well, I think the delivery of healthcare at Shawnee Mission the effective delivery of healthcare at Shawnee Mission is achieved through a number of different people that work together to make it as efficient, as convenient, as safe, as thorough, and a procedure or medical experience as possible. I think an integrated approach to taking the best care of the patient possible, and that includes efficiency with a number of different caregivers that deliver the quality that we're expecting in medicine. I think people are a little concerned about safety during medical procedures, particularly colonoscopy. And some statistics in the past have suggested that colonoscopy is risky to some extent because of perforation, when in actuality the risk of perforation is exceedingly low in experienced hands, somewhere in the range of 1 to 5,000 to 1 in 10,000. Well, the risk of not getting a colonoscopy entails a risk of developing colon cancer in approximately 5% of the population if they're not screened. And it is the second leading cause of cancer death, and a third of all patients that are diagnosed with colon cancer die of colon cancer. I'm Dr. Randall Brown, a gastroenterologist at Shawnee Mission Medical Center.